How many times do you have patients come to your office, receive quality medical or dental care, and leave without paying a dime? Probably more times than you'd like to recall or admit. Let's talk about that right now. I'm David Weiner, the CEO of Cash Flow Strategies. I work with medical and dental practices nationwide to help them increase their cash flow, keep more of what they earn, and stay compliant with all of the regulations that they face. Stay with me because I have a free offer for you at the end of this video that will help you to do just that with no cost and no obligation. Getting patients to pay at the time of service is vital in an industry where the cost of doing business practically doubles each year. But putting a price on caring makes almost everybody uncomfortable. Our primary job is to take care of people's physical and emotional needs, and somehow we have to work in asking for payment for those services without appearing unsympathetic. How do you handle this delicate situation without offending patients or giving away the farm? Start by developing a written patient financial policy. A patient financial policy lets your patients know what you expect of them and what they can expect of you. A well-crafted policy will prevent patients from being surprised about their financial obligations when they receive your services. It'll also give your practice some legal protection should a patient fail to pay what you're entitled to collect. Some of the items that should be covered in your patient financial policy include when payment is due, who's responsible for payment. For instance, self-pay patients are responsible for the entire amount of the bill. Patients in health plans are responsible for any amounts not covered by their insurance. You should include how copays and deductibles will be handled. For instance, copays are collected at each visit without exception. What forms of payment do you accept in your practice? Your practice's policy regarding non-payment. For instance, you may enlist a collection agency's help after so long of a period of time of non-payment. If your practice charges patients for missing appointments or for being late, don't forget to include that information in your financial policy as well. Putting it on your appointment cards on the backside isn't a bad idea either. In my opinion, patients should only be charged for missed appointments if they know about the potential for it in advance. You can also use your payment policy to explain discounts for self-pay patients, if you offer any. Some practices offer a discount equal to what Medicare allows if self-pay patients pay at the time of service. If they don't pay then, they don't receive the discount. And I think you'd agree that $42.50 in the bank is worth much more than $50 sitting in accounts receivable for 90 days or more. You'd be amazed at how grateful patients are for the discount and how much it can help your practice's cash flow. Once you've written your patient financial policy, have each patient read, sign, and date it. Then add it to their chart. If a patient says, "I didn't know I had to pay my copay or deductible," or whatever, simply refer to his or her chart. There's something about patients seeing their own signature on a document that seems to make them more willing to comply. Why patients don't pay? Most patients are pretty good about paying their bill. Some patients are hesitant to pay anything up front simply because they don't understand how their insurance works or what services are covered or aren't covered. You may have had patients ask, "Why does the doctor need my $10 or $20 copayment in addition to what he's already getting from the insurance company?" These patients usually aren't trying to be difficult. They're not trying to game the system. They simply need to be educated about copayments, deductibles, and covered and non-covered services. Most insurance companies now have automated systems that can supply you with this information, usually within minutes. With one phone call, the system will fax or email to your office a description of your patient's benefits, including deductibles, copayments, covered services, and out-of-pocket limits. This is extremely valuable because that can make things much easier when approaching your patient about his or her financial responsibility. You can keep these documents in the patient chart so they can be readily referred to when a question comes up about coverage, responsibility arises. Others simply forget to pay or can't find your statement, and they just need some gentle reminders, and they will usually pay you sooner rather than later. Some of them are going to wait until they hear from a third party like a collection agency before they realize that you are serious about collecting their bill. And if you practice long enough, you will unfortunately encounter a few people who have absolutely no intention of paying you. These people will try to dominate, manipulate, and dump guilt on anyone they can, anyone they think they can intimidate. They have one goal in mind, is to get away with as much as they can. What they can get away with depends on how you handle the situation. The key in dealing with patients who don't want to pay is to stand your ground and rely on your policy. Be calm, be polite, keep referring to that payment policy, and inform your non-paying patient what they can expect if they refuse to pay. Of course, some patients have genuine difficulty when it comes to making ends meet. An astute doctor or practice administrator can ascertain when this is really the case. People lose jobs, get divorced, or face catastrophic illness or even a pandemic. These people need our help, and they'll be truly grateful when you're able to give them a break. When discussing payment policies, there is one rule that I feel is crucial, even if it's difficult to follow. Doctors should try to distance themselves from the actual collection process. A well-meaning doctor who tells a patient that he or she can wait and pay what's owed next time undermines the staff person's authority and credibility, and it also sets up a silent payment arrangement. If I complain loudly enough, the doctor will let me get my way. Of course, there are always going to be special circumstances when a staff member may want to confer with the doctor. For instance, when a patient has confided that he or she has lost their job or is experiencing some other financial hardship. But this should not be done in front of the patient. Once the payment policy is in place, it should be effective enough to handle the most situations without having to take the doctor away from physically assisting his or her patients. Every dollar counts. Unfortunately, keeping practices up and viable gets tougher every day. We struggle to survive in an industry where outside sources tell us how much we'll get paid, when we'll get paid, or even whether we'll get paid at all. This makes it more important than ever not to let the money you're entitled to slip through your fingers. That money may be the difference between keeping your practice doors open or having to close them down. I would be happy to review your existing patient financial policy and make suggestions on how to make it more effective and more compliant. I do this at absolutely no cost because I know how important it is that you have a policy that protects your practice. Just email me a copy of your current patient financial policy. I'll send back my evaluation and some suggested edits. If this video has been helpful to you, please hit that like button and leave me some comments below. And if you'd like to see more videos that can help your practice increase cash flow and your bottom line, subscribe to the channel and click on the notification bell. You'll also get notifications when I do a new episode of my weekly live stream, Mr. Cashflow Live. I'm David Weiner, Mr. Cashflow, CEO of Cashflow Strategies. After all, it's your money. Keep more of it.